Yes, it's true. 7-Day Dental has the best doctors and great staff. 7-Day Dental is giving all senior citizens a complete exam for this month only, including x-rays for only $35. You heard it right, only $35 for exam, including x-rays to all senior citizens. Go to 7thdaydental.com to find the location nearest you. 7thdaydental.com, where smiles are born.
Welcome back, where we have a couple guests that were on about a month ago. They come on every so often from 7-Day Dental. We have Dr. Christine Chung. Nice to see you again.
Good morning.
And
nice to see you.
Dr. Chuck Lee. Nice to see you.
Nice to see you. Good morning.
It's great to have you here today in a subject that I don't think we've talked about before, and that's about someone gets dentures put in, and maybe they feel like, okay, I'm done. I don't need to come back, and don't get regular checkups. They may have ill-fitting dentures, right? There's a lot of different issues that can happen.
Yes, I want to stress the importance of wearing dentures. Most people think when they don't have teeth and they have dentures, they don't necessarily need to go to the dentist and have checkup regularly. But I do recommend at least once a year, because dentures sometimes don't fit well over the years due to bone resorption or the gum that has been receding. So we need to check, and if there's ill-fitting, we need to address and correct it. Maybe they need a new set or even just a simple reline. So
dentures can be relined then?
Yes.
Okay.
Also, a lot of people need to be aware of oral cancer screening. Dentures, being that they move around, they can rub and they can irritate the gum, and the gum can turn into something that we don't want it to turn into.
That's a good point.
So we like to, once a year, we like to have patients come in, evaluate the denture, evaluate the tissue under the denture to make sure everything is just right. And also, a lot of times, patients like to wear dentures at night, and when they do wear dentures at night, they're going to do things that they normally wouldn't do if they didn't have dentures, or what they did when they had their own teeth, which could be teeth grinding, clenching, and just anything you could think of. And sometimes by doing so, it shifts the dentures and they start biting in a wrong position.
How long in general will a set of dentures last? And it depends. They have full dentures, partials. Is there, even the best quality ones, is there a finite amount of time when it gets to the point, well, these have to be replaced?
Well, I like to say that I want to give it an average of 5 years.
Okay.
It could be 5 to 10 years or shorter or longer. It really varies from patient to patient. But any time that a patient finds a denture is not fitting well, I urge them to go see a dentist, because when you have ill-fitting dentures, you can even lead to more bone loss because of pressure that being stressed unevenly among the bone in your mouth.
What about the way you put the dentures in, and the different, you see the ads on TV, the denture creams and all that kind of stuff. How good are they? Is there a certain one you recommend? Should you go to you folks to get that type of thing?
No, denture creams is definitely good, and it's very personal. Usually they go to the store and they usually try 3 or 4, and they find out which one they like. It's kind of like finding the type of gum that you like to chew. But I want to just stress on what she said is that dentures, if you have parafunctional or it becomes where the patient's always going to feel like the dentures fit fine. But the truth of the matter is, if they bite unevenly, their bone is going to resorb a lot more in that one area. And if we don't reline or readjust their bite, it just becomes warped. The whole set of denture, instead of being where you wear it down evenly, it becomes uneven wear, and uneven wear leads to a lot of things like jaw problems and premature loss of breakage of dentures. And I think also the teeth wear down a lot faster if your bite is not right. So what we like to do is when we see the patient, and we recommend once a year patients come in, we evaluate the dentures and we tell them, look, what we see, and make sure that there's nothing going on underneath the gum, and then we see if they need to have a reline. Because if the bone resorbs unevenly, if you reline at that point, you can stabilize it more rather than wait and wait and wait. So usually the top dentures, the main problem is patient gag. Because they gag, they can't really wear a denture right, so they'll try to bite in a certain way so to avoid it being gagged, maybe pushing it down so it's not touching the palate so much. And usually on the bottom, the problem with the lower denture mainly is that people talk, and when they eat, their tongue lifts up, or when they smile, the tongue lifts up and the lip lifts up, and so the lower denture, the number one complaint is always loose. So that's where we recommend dental implants, to put at least a minimum of 2 up to 4. It depends on how stable they want the denture to be.
And that's something you can do too?
Yes.
All right. And now when you get the implants, it's far more permanent then, as far as the dentures being on there exactly how they should be, right?
Yes, because it's tight fit. It's like lock and keys.
And you're not taking them out every single day? And
You can. Dental implants is a very big subject, but to be basic, usually a lower denture, you can do a minimum of 2 up front. And if you have 2 up front, it's going to stabilize pretty much where you feel good.
Right.
However, some patients want to have very stable, then you would at least put 4, because if you put on 4, then it's much more stable where they can chew everywhere. But if you put on 2, mainly you want to just chew in the back and be careful, because if you chew only in the front, it's going to lift, the back will lift off.
Okay.
So I try to explain to my patients, denture oval implants is just like you have a table with 2 legs, 3 legs, or 4 legs. And with something on top of 4 legs, of course, it's more stable. So the more implants that you can retain the denture, the more stabilized the denture is.
Okay.
And that will go back to the subject where gum disease is so important, because if you catch gum disease early, you can prevent from bone loss and then eventually tooth loss, which you don't necessarily need to wear dentures.
What about as far as, I know this might be off subject a little bit, but it certainly leads into it, as far as losing teeth as we get older, is part of that hereditary as well? If you know that maybe your parents or your grandparents lost some of their teeth early, is that part of your makeup, or it's just maybe they didn't take care of their teeth as well as they should have?
I think a lot of times if the parents didn't really take care of their teeth, the kids don't usually take care of it.
Yeah.
People see what people do.
Right.
And I feel like it's maybe a portion hereditary, but I think it's more environmental, and it's more of what we do. So again, regular checkup, so that we can evaluate to see what kind of recall we should put the patient on is very important. There are patients we put on 6 months recall, there are patients we put on 3 months, there are patients we put on 4 months. It's just based on what we find when we evaluate their gum tissue and how their teeth are, how fast they build up. Some people build up a lot slower calculus than others, and they can be up prolonged a little bit. But usually, if a patient has a problem with gum, they want to come back at least 3 months.
Okay, very good. You folks, what's unique, we've talked about this before, 7 Day Dental, is that you have different locations, your closest one, and then you have other ones in the area. But the unique thing about that is if someone, maybe their dentures are bothering, and it's Sunday morning, and they have something to do later on that day, you have one of your places that can help them out that's going to be open. Right?
Yes. And if they break their denture on Mother's Day or Father's Day, we can fix it that day.
Okay, did that happen yesterday?
I'm not sure.
Okay.
Yeah.
But
the beauty is we
Okay.
have the lab inside our office that we can temporarily fix for the
Great.
day off. Because I know Saturday, Sunday, most labs are not open.
Yeah.
So, yeah.
Very good. All right, great information. We appreciate you coming on. And you can see the subject is quite broad when we get into implants and things like that. So maybe next time we'll get into that a little more. You can maybe bring a model or something. That would be
Sure.
fun. All right, good to see you again.
Thank you so much.
7daydental.com and located right nearby, right?
El Toro and Moulton.
Right next
Okay.
to Vaughn's.
Right next to Vaughn's. All right, very good. And great advice. If you feel you have problems with your dentures, maybe you've had them for a while and you're not seeing a dentist regularly, give these folks a call. They're right nearby here, and if anything, get those checked out. Nice to see you again.
Thank you.
Thank you.
All right, you two take care. We'll be right back. It's funny how you